I am a professor of electrical engineering in the Indian Institute of Science. I got my doctorate degree in biomedical engineering decades ago in IIT Madras by working with leprosy patients. Here I want to share with you some important facts about this COVID-19 that neither the press nor the media has given to us. Knowing which, we will know that we are already doing very well in terms of health and there is no need for fear. And in these times of opening the lockdown, we will we will start working much better on our health. To begin with, let's see a really bright news. Nearly 17 lakh patients around the world have fully recovered and have returned home. This is not only in rich countries, but in all the poor countries, 217 countries to be exact. Even though there is absolutely no specific targeted medicine for the same. And yet, anybody has not come up with any vaccine yet. So some claims are there. And being a new virus, doctors are still learning about the disease and changing the method of treatment and medicine every day. Inside all this, what has really worked is the work of these heroes, the immune cells in our body. And that is what is given by the nature to us. And these heroes have cured 17 lakh patients, both rich and poor, in developed and underdeveloped countries around the world. So immunity is our most effective and useful weapon. And this whole talk is about, and that is the most important thing and not anything else. And we need to do everything to keep it operation ready. For that, first we need to give up fear. See, if you are followed by a barking dog, and you are out of fear or running, the body sends all the blood into your hands and legs to take care of that exigency. Until you come out of the fear, other things in the body are stopped. Digestion, growth, immune system, and everything. That's perfectly fine if it is for a few seconds, few minutes. But what about the constant fear induced by this coronavirus and the media and the propaganda? This constant fear gives us constant anxiety, which gives you constant stress, and it completely suppresses your cell-mediated immunity, which is very, very critical for that. And once you understand whatever I'm going to say, then you will give up that fear and peacefully smile and take good care of your own health. Why I'm saying novel coronavirus is not a killer virus, because it depends on how good is our immune system. If your immune system is really good, then it cannot kill you. In India, the population is 138 crores. And the total number of people who have died is 2,753 so far, which means for this population, it works out to 20 deaths per crore of population. Compare it with, for example, these 5 European countries where the maximum deaths have happened. Out of 3 lakh deaths in the world, 1/3 has happened in just 5 countries with a population of only 20 crores, which is 1/7 of Indian population. And the death per crore of population in these countries is nearly 275 times India. And if you take 4 of those countries and add USA, the population goes up to 57 crores. The number of deaths is 2/3 of the world. And if you add another 10 countries, the population becomes comparable to India, but the number of deaths is 100 times. That is 90% of all deaths in the world have happened in only these 15 countries. It's very unfortunate. And these countries have to really do a homework of why this is happening. And because this is not only happening for coronavirus, it's also happening for the flu virus, which has been there in the world with us for almost 100 years. And if you look at all other 202 countries in the world where coronavirus is there with the population of 660 crores, the total deaths is only 34,000 or 50 per crore population. So clearly there is some big difference between certain countries, majority of countries, and a few European countries and US. So let's now compare India as an example with 5 developed countries, you will see that the stark differences exist not only with respect to the COVID flu, but also with respect to the regular influenza flu. As you can see, the per capita income in all these countries is 15 times to 30 times, so they are called the developed countries. So with all the money, with all the technology in the hospitals, things have not improved. So there are other reasons. While the number of deaths per crore population in India is 20 as on today, in the United States it is 100 times, and in Spain it is nearly 300 times. And there are countries where it is even higher. And the situation with respect to the flu, which has been there in the world for 100 years and also a vaccine is available, is similar. The number of people who died out of flu in India last year is only 8 per crore. And here you can see in Italy, it is 300 times. In United States, it is 200. Again, 300 times. And some of the other European countries, nearly 200 times. So they need to really look at what is compromising their immune system. Now, let's compare this deaths due to COVID-19 with all the other deaths. I'm comparing between India and USA as an example. USA has a population of 1/4 of India. So roughly many of the deaths as a yearly basis are in the same ratio as their population. Whereas here it is 10 million, here it is 2.8 million. And all suicides in India, 135,000, 48,000 in US. Murders, 45,000 and 16,000 in US. Road accidents, 151,000 and 38,000. Whereas infant mortality, which may be due to malnutrition, is much higher in India. Cancer is much higher in US. Cardiac deaths, comparable. Pollution deaths are much higher in India. Now, if you look at COVID and flu, you can see that both of them are in the same ratio, very, very high in US. Compared to 2007 in this period, it is 88,000. The number of people who have been infected in India is less than this, whereas the deaths are here. So this is really a killer virus in US for their population. To some reason, that needs to be analyzed, whereas it's not here and most of the other countries in the world. Flu again, last year it was 1,200 here, 60,000 there. Now, are we going to get a really safe and reliable vaccine? When is it? See, influenza came into the world in 1918, 100 years ago. And the vaccine was introduced in 1945. So vaccine is given in all the European and countries and US where the deaths are still very high. And as on today, they are saying that it's only 50% effective, which means people who have taken the virus are still dying. AIDS came in 1984. Again, it was a big shock for the world, and a lot of money and time was spent, but they could not come up with a vaccine till today. SARS-CoV-1 came in 2003. Now it is 17 years. With a lot of money and time and energy, they came up with a vaccine, but it completely failed on animal testing, so they gave up. So you can imagine, when are we going to have a reliable virus that will work in spite of the various mutations that the virus is undergoing? It's clear that our only reliable refuge is our immune system, not the medicines, not the technology, not the hospitals, not the future vaccine. They are looking at plasma therapy. If it works, it really works based on the human immune system, because if I get well due to my immunity, then my plasma with the antibodies against the coronavirus can be injected to other critical patients and save them. So if this proves effective, then with the 17 lakh recovered patients, we can save almost all the patients of the world. And these people who have recovered from corona already by their immunity will become heroes instantly. And vaccine, whenever a reliable one is available in the market, it works only by triggering our immune system to be ready even before the real virus attacks us. And it's my view that it may not work with a compromised immune system, which is visible in all these countries now. So the virus will also undergo mutation and make the vaccine ineffective, but not the immune system. Our immune system doesn't know what this virus is, but 17 lakh people around the world have been cured because of the immune system. So if you keep it well, it can work up against the future virus. So whatever way go, whatever we do, our reliable victory over the novel coronavirus and all the future viruses depends only on the readiness of our immune system and not on any vaccine, in my opinion. We are clear our health is in our hands and not in anything else. Hospitals, technology, and vaccine do not and cannot give us health. We go to these things only after we are ill. What I define as good health is that I don't even go to a doctor.